A move by the CDC today that could pave the way for a close to normal learning experience for many children when school starts this year. The CDC issued new guidelines today saying students, teachers, and staff who are fully vaccinated will not need to wear masks in school beginning this fall. The move in part to encourage more children to get vaccinated. This comes as there's confusion over possible booster shots to limit the spread of the Delta variant. Pfizer asking for the government's approval of a booster shot, but right now officials say that is not necessary. Our Kaylee Hartong leads us off tonight.
The CDC is urging schools to open and return to in-person learning this fall, saying vaccinated students and teachers don't need to wear masks. But individuals 12 and older who aren't vaccinated should still wear them, which includes millions who are under 12 and can't get the vaccine yet. Unvaccinated children should learn at least 3 feet apart, but the CDC says spacing limitations should not stop schools from reopening.
We've done a reevaluation of the science, and the science has showed us that we know what works to help keep schools safe and open for the coming school year.
The CDC guidance are just recommendations. It will ultimately be up to the school districts to make their own rules and decide whether to require proof of vaccination. Children under 12 still can't get a vaccine. Christian Garrido, a father of 3, says his kids were just asking him today about rules for this fall.
It's a little confusing. I have a 9-year-old and an 11-year-old, and they're not old enough to get shots yet. So we're still kind of worried about them going back to school in person.
Here in California, schools will keep requiring masks. But in Arizona, there's a ban on mask mandates in schools. And masks will be optional when Chandler Unified reopens in 2 weeks. With the Delta variant racing through under-vaccinated areas, the CDC tracking COVID outbreaks at teen church camps in Illinois and Texas, and an indoor gymnastics facility in Oklahoma.
We are seeing some small clusters and larger outbreaks of COVID-19 in locations such as camps and community events where proper, hard-learned prevention strategies are not enforced and the virus is readily able to thrive.
And tonight, there is growing confusion over the need for booster shots. Pfizer announcing it will ask the FDA to greenlight a third booster shot be given 6 to 12 months after the second dose for better protection against the Delta variant. But just hours later, the CDC and FDA pushing back, saying Americans who've been fully vaccinated do not need a booster shot at this time.
Kaylee Hartong joins us now. And Kaylee, some teachers tonight are concerned about these new guidelines.
Yeah, Byron, one teachers union, the NEA, says that they want schools to require masks where unvaccinated individuals are present. So that puts them at odds with the governors of states like Arizona and Florida, where they say masks in schools should be optional. Most interesting to me today, speaking with one father who said it was actually his kids who were more concerned with the rules than he was. Byron.
Kaylee Hartong, thanks so much. For more on these COVID developments, we bring in ABC News medical contributor Dr. Darien Sutton. Doc, thanks so much for joining us this evening.
Good evening.
As an ER doctor, you've seen the devastation of COVID-19 up close. So do you think teachers and students can feel safe in a maskless classroom this fall, particularly with the spread of the Delta variant?
Well, good evening, Byron. I think that first I want to acknowledge that in-person learning for children and young adults is essential for social and academic development, but we want to get there with an abundance of caution and using safety as a priority. I think that these recommendations that have been given out by the CDC today are quite confusing and unfortunately are going to leave the work of managing this global pandemic onto local school districts, which is a very tall task to accomplish.
Doc, we're sure to see a patchwork of COVID rules in schools across the country. As Kaylee just mentioned, the CDC guidance is only a recommendation after all. So what advice would you give to all parents, regardless of the COVID precautions their schools adopt?
Well, I personally believe that if you have not been vaccinated, to wear masks, and that includes anyone above the age of 2. As far as for parents, my advice to them is to call your local school districts and find out the rules and make a plan. Find out what is the testing surveillance guidelines, what are the rules regarding isolation and quarantine, and also get vaccinated, making sure that everyone in your home is vaccinated so that if by chance that child brings COVID-19 home, it stops there.
As Kaylee reported, Pfizer came out ahead of the FDA and the CDC on the potential need for a booster shot. Do you predict we'll all need to be getting booster shots at some point?
At some point, yes, possibly. I have to say that because we're still waiting on more data to come in. But right now, no. Although we have gotten this information from Pfizer in terms of the antibody response and the response to a third dose or a booster vaccine, that has not translated to real-world evidence, as we have no indications that show us that the vaccines are proving to be ineffective. They're actually working quite well right now. And so there is no indication at this point currently to get a booster shot.
And Doc, last question. Due to the Delta variant and the recent uptick in cases, should vaccinated people be around non-vaccinated people without a mask on?
Well, it depends on your level of caution, and I think it depends on your risk hesitancy and how best you can mitigate those things. Personally, for me, if I'm around others who I don't know or who are unvaccinated, I think it's best to err on the side of safety and wear a mask. And if you're in a location in close contact with other people from different households, to wear a mask. We know that this vaccine is proving to be effective, but nothing is 100%. And so I always ask my patients to err on the side of safety.
Dr. Sutton, always grateful for your insights. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.